So a lot of times with flossing, we never talk about how to floss a patient. We just assume everyone knows. So some little tricks with flossing: wrap your floss around your middle fingers, and then make sure you only have about 1 inch, 2 inches in between your fingers. A lot of times I see patients with, or people with really long, and it's really awkward to control. So make sure you only have 1 inch to 2 inches between your fingers, and then always have a fulcrum on the face as you floss. So a lot of times if we try to floss and we just hang out, we tend up snapping and it hurts the patient. So if you have a fulcrum, I usually rest on a patient on their chin and then their zygomatic arch. Then you can have a little bit more control with the floss. And then when I switch to the other side, keep a fulcrum somewhere, switch, and then floss with the C shape. Again, that'll really just help you keep in control. Oh, he has no contacts, but up and down. And then when you switch sides, keep a fulcrum somewhere with one of your hands just to have more control.